So let's talk about what we're giving away here. Modified Independence is all about falls prevention for seniors in our community. And this year for Christmas, we are donating 145 pairs of hospital socks, along with a piece of education to the residents of Noble House here on the west side of Jacksonville. And uh, I firmly believe that providing people with knowledge is the best way to start combating the falls epidemic in this country. So the STEADI Fall Risk Assessment is included in every package with a pair of hospital socks. And if you read down through it, it's pretty self-explanatory. If a person scores 4 or more on this assessment, they're considered to be a fall risk according to Medicare and the CDC, and actually qualify for a home safety assessment billable under insurance, for which Modified Independence, if you look at the back of the card, all of our information is there, so patient can literally take this card to their doctor. The doctor can get an insight into how the patient feels about their stability, and then send us over a referral. So if you look here, the first question: I've fallen in the past year. A fall is just an unintended descent to a lower level. That's all a fall is. So if that's happened, that's 2 points. I've been advised, or I use, or have been advised to use a cane or a walker. It doesn't denote who told you that you needed to use a walker. So your kids can feel like you need to use a walker. Somebody at church, your doctor, your nurse, your therapist, anybody. Third thing, sometimes I feel unsteady when I'm walking. That's just an internal truth that patients, they know that. And as a clinician, you can see them when they don't feel steady. I steady myself by holding on to furniture. We see that all the time in home care. We see patients that steady themselves. So we call it furniture walking. I'm worried about falling. Patients verbalize this all the time, say that they have balance issues, and it prevents them from doing X, Y, and Z. I need to push up with my hands to stand up from a chair. You can literally watch a patient do this. I have trouble stepping up onto a curb. This is answered by whether somebody can even step up one step coming into their home. I often have to rush to the toilet. Often patients are on diuretics and things like that, or they just don't move quickly, or they don't feel the sensation that they need to get to the restroom. I've lost feeling in my feet. That's related to diabetes and peripheral neuropathy and things like that. Obviously, if you can't feel your feet, you can't feel how you're connected to the earth, and you can't overcome the force of gravity when you don't feel that feeling. I tell people all the time, just imagine sitting on your feet for an hour until you get that achy, tingly, painful, numb, and then put your feet down on the floor and try to walk across the floor. Even as a young person, it's not easy when your feet are numb. I take medicine that makes me feel lightheaded or tired. That's going to be blood pressure medications, pain medications, muscle relaxers, anything of that sort. Personality enhancement, which is the next one. I take a medication to help with my sleep or improve my mood. If you know somebody who takes a happy pill or takes a pill to help them sleep, obviously this can cause them to fall. And we know that on an order of 3 to 1, more people fall in the bedroom than the bathroom, typically because they're on one of these medications that they're still drowsy. And then the last one, I often feel sad or depressed. That's something that we should be looking at with our seniors anyway. But if they are on an antidepressant or they express feelings of sadness, typically that's going to lead to a lot of sedentary behaviors and things like that, which increase the risk of falls. I hope this helps. Y'all be safe. Have a great day. Call before mom falls.